it's very important to note that the Trinidad and Tobago has a very, very high prevalence of NCDs, and I will go through them one by one and to elaborate. All right, first slide. So how does COVID-19 impact on NCDs? So we have NCDs that we're talking about today, non-communicable diseases, diabetes, also known as sugar, hypertension, also known as pressure, asthma, obesity, cancer, and heart disease. And one of the things that we will keep repeating ourselves today is to vaccinate today. Don't hesitate, vaccinate today. Next slide, please. So COVID-19 and diabetes mellitus. So the care of COVID-19 patients with diabetes poses unique challenges. And we very well know that patients with diabetes are at risk of more severe illnesses. COVID-19 appears to precipitate severe manifestations of diabetes, such as diabetes ketoacidosis. Next slide, please. So COVID-19 patients who are also diabetic, and this is where we have a lot of complications. So COVID-19 patients with type 2 diabetes are more likely to have serious complications, and in China the case fatality rate was 7.3% amongst patients with diabetes, most likely type 2 diabetes, whereas the overall case fatality rate generally was 2.3%, which is extremely high, and we hear it over and over again. The daily death rate, death counts, they are always associated a high prevalence of comorbid conditions. In a retrospective study from the United States, the mortality rate was 14.8% amongst patients with diabetes and 28.8% in patients with diabetes or uncontrolled hyperglycemia, compared with 6.2% without either. So diabetics have generally a much longer stay in hospital and a very much higher risk of death from COVID-19. Next slide, please. So COVID-19 and high blood sugar, hyperglycemia, and obesity. So poorly controlled diabetes is a risk factor for infection in general. Elevated body mass index has been associated with a very high increased COVID-19 mortality. Next slide, please. Obesity, a very important risk factor. The sustained increase in national rates of overweight and obesity is also a reason for concern, especially in light of the higher risk of more severe COVID-19 related illnesses and death in people with obesity and other chronic NCDs. A study of 2,500 patients in New York City revealed that obesity was associated with a markedly increased risk of intubation or death among adults with less than 65 years of age. And an analysis of 75 studies showed that obese individuals had a 45% or higher risk of being COVID-19 positive, 113% risk of being hospitalized, and 74% higher risk of the need for intensive care unit care, and 45% increased risk of death. In a nutshell, basically, get vaccinated today. Next slide, please. COVID-19 and hypertension, or pressure as it's known. So growing data shows a higher risk of COVID-19 infections and complications in people with high blood pressure. In the early stages of COVID-19 in Trinidad and Tobago, it was very much noted that the mortality rate was almost exclusively associated with persons with high blood pressure. In Trinidad and Tobago today, our prevalence of high blood pressure is 30% of the adult population, which equates to about 300 per 1,000 persons who are at high risk of developing COVID-19 complications. So data from China and US shows that high blood pressure is the most commonly shared pre-existing condition amongst those hospitalized, affecting between 30% to 50% of patients. And important, a report from Italy revealed that 76% of patients who died from COVID-19 had hypertension. So don't delay, get vaccinated today. Next slide, please. COVID-19 and heart disease. In most of the vaccination sites and centers, especially when we do outreaches, we have a lot of questions from persons coming up and asking, I have high blood pressure, I have heart disease, I'm on these medications. Should I take the vaccine? And our message to you today is to don't delay, get vaccinated today. Because, for example, COVID-19 and heart disease. Having heart conditions such as heart failure, coronary artery disease, cardiomyopathies, and possibly high blood pressure can make you more likely to get severely ill from COVID-19. And COVID-19 can damage your heart directly, especially if your heart is already weakened by the effects of high blood pressure. If you have coronary artery disease, which is the buildup of plaque in the arteries that supply your heart, the virus could actually make those plaques more likely to break apart and cause a heart attack. Past studies show that people with heart disease who get respiratory illness like flu or earlier types of coronavirus are also at higher risk of heart attack. And COVID-19 may also cause inflammation in the heart muscle, a condition called myocarditis, which makes it harder for the heart to pump blood. Next slide, please. COVID-19 and asthma. People with moderate to severe uncontrolled asthma are more likely to be hospitalized from COVID-19. Although those with coexistent COPD and non-allergic asthma compared to allergic asthma are at increased risk of worse outcomes. To reduce your risk of these outcomes, continue avoiding triggers and taking prescribed medications, controller and reliever therapies such as inhaled corticosteroids, example Bicotide, and inhaled beta agonists, example Ventolin, and don't delay, get vaccinated today. Next slide, please. And this is another frequent question we have from members of the public. People who have cancer have higher risk of severe illness from COVID-19. Most data suggests there's a higher incidence of COVID-19 in cancer patients when compared to the general population. The CDC considers that cancer represents an established or probable risk factor of severe COVID-19. Notwithstanding possible decreased immunogenicity, all individuals with active or prior cancer who are eligible to be vaccinated should be vaccinated against COVID-19. So don't delay, get vaccinated today. Next slide, please. So once again, how do I protect myself from COVID-19 if I have an NCD? So primarily, get vaccinated. Speak to your primary care physician or specialist if necessary. Practice the 3 W's. Take all medications as prescribed by your physician. And this is the focus that we'll be going in. Improve your overall health to help control your NCD. So eat healthy, drink water, eat more fresh fruits and vegetables. Avoid or limit alcohol. Get moving, exercise. Decrease salt in diet. Lose weight if overweight, and quit smoking. And once again, don't delay, get vaccinated today. Next slide, please. And finally, the take-home message. NCDs increase the risk of severe COVID-19 disease and death. All the COVID-19 vaccines that are available locally are WHO approved and have been shown to be safe and effective and protect people against COVID-19. And finally, don't delay, get vaccinated today. Thank you very much.